Al Kleckner, and I'm the Brookline's appointed town administrator. Today, we have convened this briefing to inform the community and our town leaders of efforts to address the COVID-19 crisis. First, I want to assure the public that the town is taking the COVID-19 matter very seriously. I have convened a staff task force comprised of public health, public safety, and public education department heads. And many of them are here behind me this afternoon. We have been meeting multiple times per week and are doing the best we can to process this dynamic situation and prepare for more substantial decisions when the situation requires it. We have developed a consolidated web page with all relevant information related to the COVID-19 matter, and the website URL is listed on the board in front of me. More importantly, we want to remind the community that we have a community alert notification system, referred to as Brookline Alert. And when subscribed to this system, you will receive a text, a call, or an email informing you of timely information related to the town of Brookline. So we encourage everyone, if they're not sure whether they're on this system, they're subscribed to the system, to go on the web page for the Brookline Alert system that's here in front of me and sign up. It is where people will receive the most immediate information when it occurs. Today, we will hear from Dr. Swani Jett, who is the town's Director of Public Health and a trained epidemiologist. And we will also hear from Ben Lummis, our Interim Superintendent of Schools, about actions that are being taken in the school system and planning in place when a positive exposure to the virus is experienced in our school system. Finally, I will address the continuity of the town's government operations and essential public services, and also the complicated legal and practical issues that are involved in making decisions to limit social gatherings or in our local government and community. At this time, I will call on Dr. Jett to address the public health issues.
Most appropriate thing to do. Good afternoon. Well, first I want to provide just a little bit of guidance from the state and as well as CDC. Anybody traveling to level 2 or level 3 countries are asked to self-monitor and stay at home for 14 days. Anyone that has traveled specifically to China, Iran, South Korea, Italy will be quarantined for 14 days. That notification actually comes through Brookline Public Health. Current situation in Brookline. Currently we have no cases. We are at low risk. I am currently monitoring 14 people who have traveled or attended BioGen conference. All of them have been asymptomatic at this point. Most of them will be out of quarantine by later on this week. To date, most of the transmissions that have occurred in other communities have been through to close contact with the individual within 3 to 6 feet. That includes people being at home among their families, nursing homes, churches, and hospitals, and a few public gatherings. Majority of people that have been affected, believe it or not, has been from the age of 30 to 69 years of age, with the average being 51. The most severe cases included people with chronic diseases, such as cardiovascular or diabetes, etc. Asymptomatic cases have been rare and very low, as to 1% in the overall community. Majority of the cases exhibited symptoms. The best practice to stop transmission, and this has worked in other countries as well as China and Italy, is number one, isolate and quarantine. So if you have been quarantined, that means no movement whatsoever. That means not attending meetings, not attending any type of social gatherings, not going to the store making any runs or errands, anything. So in that essence, I would ask everybody to make sure they have enough supplies to last 2 weeks. The COVID will only be transmitted if you're out and about in the community. If you are quarantined and you become ill, please call your PCP or call the ER and alert them that you travel or you're symptomatic, and they will make sure that they have a mask prepared for you when you come in. And the last thing is, continue to wash your hands. Hygiene is the best method to prevent transmission. Continue to wash your hands, continue to practice good hygiene. If you cough or sneeze, make sure you cover your mouth. If you notice somebody's sick, keep a safe distance and prepare to be at home. So that means in case something occurs, you are prepared so that you can work from home and you can telecommute. Thank you.
Thank you, Dr. Jett. Now I'd like to hear from Ben Lemus, our interim superintendent of schools.
Thank you, Mr. Kleckner. So first, I want to thank Dr. Jett and his staff at Brookline's Department of Public Health for their daily support of our schools and school community. Every day we are working very closely with Dr. Jett. The public schools are making all decisions about how to keep our schools healthy and safe in collaboration with Dr. Jett and his staff. As our school community knows, we have been communicating regularly with families and staff about the coronavirus threat and what we are doing to keep our students and staff safe. First of all, I cannot repeat enough to our families, students, and staff, if you are sick or feeling sick, please do not come to school. The number one way to prevent the spread of any illness in school is for anyone who is sick to stay at home. We have advised all families and staff who have traveled to China, Iran, South Korea, and Italy to stay home and stay away from school for 14 days and self-monitor. In our public schools, we've increased our cleaning protocols, and our custodians are now doing daily disinfection and cleaning of high touch points. Our schools are fully stocked with soap, sanitizer, and paper towels. Additional supplies are on order and will be distributed to our schools as they come in. The Department of Public Health is aware of and working with any families that have needed to self-monitor or quarantine. At this point, we have no confirmed cases of COVID-19 in our school community or in Brookline. Because of this important fact, that there are no positive cases of COVID-19 in our school community, Dr. Jett has advised me that for now, there is no public health reason to close schools or discontinue school events. We are now planning for two types of school closures. First, if there is a positive case related to our school community, staff, parent, or student, we will close the school for cleaning and disinfecting like other master schools have done. Second, if there is a cluster of positive and confirmed cases in the school community, then we will close school for an extended period of time. Neither one of those need to go into effect at this time, but we are planning for both of them. We are monitoring developments on a daily basis and will quickly make any necessary changes to our protocols, to our guidance on travel or school events or the school day if they are needed. As we do in snow cancellations and other emergencies, we can communicate quickly through phone calls and emails to all families and staff, and also through social media and our district website. I want to close by saying thank you to our custodians and our school nurses who have been doing an exemplary job of supporting our schools, family, and staff over the past 10 days. They, like all of our staff, put the needs of our students and families first and help keep our community safe and healthy every day. Thank you.
Thank you very much, Ben. I want to wrap things up today by addressing the many actions that governments and institutions are implementing daily in an effort to address the COVID-19 crisis. Obviously, different sectors of our society and industries within our society have different population and risk factors. But we must admit that having different protocols and decisions can seem very inconsistent and confusing to the public and me. For example, many organizations are limiting gatherings of hundreds of people, while thousands of people travel on our public transportation system each day and gather nightly for sporting events and concerts. But relying on our population's willingness and ability to avoid social gathering can only go so far. And we are considering and planning for measures that would limit social gathering in Brookline where it is practical and within our local government's ability to enforce. We are strongly encouraging our state and federal government to provide more direction. We are supportive of the governor's declaration of a state of emergency, which just happened minutes ago, but we are especially concerned about the legal requirement for this town to have public meetings that are required to be open to the public. and don't allow for streaming, live streaming and other manner of broadcast that will allow the community to not only watch but participate in our public meetings. We are, in the event of widespread quarantine or limitations of social gatherings that will occur, the town is developing a continuity of its operations, including responding to police, fire, and emergency medical calls for service, for keeping our essential infrastructure operating, including water, sewer, and our road bridge systems. We are now going to conclude this briefing, and it was my intent that the Select Board would be convening at 5:30 and might use their opening part of the meeting to continue this dialogue, perhaps ask some questions. But as it turns out, we're a little early, and as well, we do not yet have a quorum of the board, and we think that it may be delayed some. So we will stay here, first of all, to answer questions from the board members that are here, and then to the extent that we can answer any other questions from the public, we will attempt to do so. Thank you. Yes.
For public safety, what will happen if an officer or firefighter comes down with the coronavirus? Will the whole shift be quarantined? With safe lifestyle?
Sure. So the question relates to what happens if one of our public safety personnel is tested positive for the virus, and how will that, excuse me, how will that impact our other staff and the services that we provide? So I think that might be answered by Dr. Jett, and maybe starting with Chief Lipson.
Thank you. Yeah, we're preparing within the department for staffing contingencies and operating with a reduced workforce in the event that part of our staff has to go into quarantine. And we will adapt so that we can provide emergency response to the highest priority calls.
I would also say that obviously the police and fire and our emergency medical providers are the first responders, and so they have modified their reporting protocols or their response protocols to make sure that only the essential personnel that need to be directly engaging with the patient or the situation does that, and not try to infect others who don't necessarily are providing a direct services to that person.
When it comes to calling on the...
Can I just, I'm sorry, follow up from Dr. Gibson on that?
So what usually happens is if a person is exposed to coronavirus and I'm alerted, so the first thing would be to do a risk exposure or an assessment. So first, that officer would be pulled, but anybody that was in close contact with that officer would also have to be quarantined for 14 days. And then the chief will make modifications from there.
About the call on from the government, from the governor about sort of clear guidelines, can you talk a little bit more about that? What specifically you want to see?
Well, so in Massachusetts, local governments are mandated to hold all meetings of boards, like the Select Board, the School Committee, the Planning Board, in public. And unless you do so, it's not a legal meeting. And so we are anticipating a situation where there may be, whether it's voluntary or mandatory prevention of the social gatherings, that we would need to have these boards occasionally meet, certainly the Select Board, regularly, and right now they cannot do that unless their meetings are accessible to the public. So it sounds like a real catch-22, and we are definitely seeking guidance from the state to allow, at least on an emergency basis, some alternative ways in which to make our meetings accessible to the public. I'm thinking more in a digital type of environment.
There's been a lot of questions about masks, and should we all go running out of our masks? And my understanding is that masks don't prevent you from getting it, but it does prevent you from spreading it if you have it. So only unless you have it or think you might have it would a mask be
So my advice,
advisable.
my advice is if somebody healthy don't need a mask unless you're going on a plane. So because you're in close proximity, somebody might be sick just from the occasional flu. You should have a mask. Now, all masks don't provide the protection that you need, but some masks will, some type of mask will help. Somebody that's sick probably shouldn't be traveling anyway. So having a mask on them, yet when they go into the hospital or they're going to see their physician, they need a mask on. But I wouldn't advise everybody to run out and get them. They probably wouldn't be able to get them now anyway because they all sold out.
About gatherings, so the governor just said, basically, he recommended that large gatherings be canceled or postponed in the short term, including major sporting events and stuff like that. Is there anything on Brookline's docket? Are you looking at anything in particular that might need to get canceled aside from down the line on that?
Sure. Well, we talked about official public meetings, and those are the ones that we talked about complicated with the state law, the state open meeting law. If you're talking about non-public meetings, gatherings of people for town events, we are definitely monitoring the governor's statement today, and we're meeting as a task force as early as, again, tomorrow morning, and we're going to take up things that we might recommend or even require the select board to adopt. Obviously, we all are very concerned and about the Boston Marathon event on Patriots Day in April. That's, of course, runs through many municipalities and is run by a private organization, although municipalities do provide a permit for that operation to happen. And so it's not likely that any one community would be able to affect that. So we're in discussions with our other partners, the state and the BAA, and are waiting to hear about that. That's probably the most important one that we're worried about. But there's many different kind of gatherings. There's official meetings, there are community events, there are worship services, weddings and funerals, and all sorts of things. So it's not easy. It's not a simple matter, and we are taking it cautiously. But my own personal feeling is that we're getting very close to the time when we're going to have to take some more immediate steps.
I can add to that. So just in terms of school events, as you can imagine, we have a number of school events of, and gatherings very often, including some that are coming up this weekend. So I just want to assure the public that this is something we are actively thinking about, and working with Dr. Jett and his staff on every day. Every day I ask that question, should we cancel these? And haven't been advised to at this point, but this is a rapidly evolving situation and may at any moment here. And certainly, as the moment we do, we will get all that communication out to our families and our schools, our principals. But it's something we're taking seriously. We're looking at every day, and we'll make the necessary call as soon as we're advised.
Are there any other questions for us up here? Otherwise, I expect the board probably will ask some questions and address some things in their public comment or announcement section of the board meeting, which will commence as soon as we have a quorum. Thank you all for attending today. Appreciate your interest. Yes, of course.
This one's for Dr. Jett, about the 14 individuals that you're monitoring. How did you find out about them? And you mentioned they would probably all be out of quarantine by the end of this week?
That's correct. So I received an alert from the State Health Department through a system that is called Maven, which is our surveillance system. And once I receive that notification, then I actually go into the Maven system and contact the person. And I do a brief history, find out everything about what happened, what occurred, et cetera. And then I tell them the protocols in terms of monitoring, and I follow back up with them each day. So majority of them will be out of quarantine by the end of this week.
And were any of them symptomatic?
No.
Thank you, guys.
Thank you all.